there is one death from cancer anywhere around the world every 3 seconds.
75% of patients don't actually know that they have heart failure until they've gone into a clinical setting.
We should recognize that the status quo is not satisfactory. It is still the number one killer around the world.
Chronic diseases like heart disease and cancer remain leading causes of death, but global health challenges are broader, encompassing aging populations and evolving threats. As healthcare demands grow, the urgency for innovative solutions has never been greater.
I started Lucence because I felt that there was a problem with how we cared for cancer, and we saw patients presenting much later than I wish they would have, and that would mean poorer outcomes.
Yet, with every challenge comes an opportunity, a chance to redefine what's possible.
Innovation has always been the bedrock of Singapore's economic strategy because we are constrained in size and natural resources, so we really need to invest in our people and in our deep capabilities. With investment in deep tech, that allows us to create disruptive solutions that can create good solutions for the world.
Singapore's been investing in its biomedical research capabilities for more than 20 years, and there's been a very strategic and deliberate effort to really centralise biomedical research as a core pillar of the economy here in Singapore.
It takes an ecosystem of players to come together to help our startups bring their solutions to the world. Government entities like A-Star, like NRF, invest in research. EDB and Enterprise Singapore really look at growing the enterprise ecosystem. Then certainly in the healthcare sector, they have to go with the clinical trials in order to help prove that the solutions would work. And then further downstream, we'll have good venture capitalists, venture builders that can then introduce our startups to the global stage.
In Singapore, institutions like A-Star Bioinformatics Institute play a crucial role in deciphering the complexities of diseases at a molecular level.
We are looking constantly at the evolution of the virus to be up to date, but we're also looking at historic data to see how we can predict the future version of the viruses. A-Star in Singapore has been working very closely with the GISAID Data Science Initiative. This is the global sharing network for pathogen data. We are able to know if in any part of the world suddenly a new threat appears. Collaboration is important, and that's why Singapore can punch above its weight, is because we are very focused. When the time demands it, come all together.
Biotech is actually a very capital and time and talent intensive industry. It is critical to have someone like a venture builder to assemble all the expertise and resources to drive the advancements of biotech.
We take a leap of faith on technologies that have the potential to be first in class, to be the unique option that a pharma company might have in their pipeline if they partner with us. Success is about building a sustainable ecosystem where innovation can thrive.
I started Lucence with the mission of bringing earlier cancer detection to a much wider group of people all around the world. We first needed to build the technology, and this was achieved by great research that was possible because of a fantastic scientific team. Today, Lucence is one of the very few companies in the United States and in Singapore to have received US government coverage for our liquid biopsy tests. And we are just only getting started because the technology is growing and helping many more cancer patients.
There have been very strategic decisions made to invest in key facilities and infrastructure that align with our ambitions as a nation in terms of biomedical research and development. Our academic institutions are among the best in the world. They really create the environment in which our people can excel and spread their wings in terms of research and development.
Today, an echocardiogram takes anywhere between 35 to 45 minutes by a very specialized healthcare clinician. And with our software, what we've been able to do is automate that process and allow for the process to be shortened by greater than 50%. And in that process, we provide early diagnosis and automate the measurements that are required. With early intervention, we have the ability to identify these diseases earlier, allowing for the patient to see cardiologists quicker.
Lucence's rise in precision oncology and thus 2AI's breakthroughs in heart care are just two success stories from Singapore's innovation engine. The future of healthcare lies at the intersection of technology, research, and human ingenuity.
One of the key advantages that Singapore has is that we are embedded right in the middle of one of the largest emerging markets in the world. And so we have a great deal of focus in diseases and health concerns that are relevant to the Asia-Pacific region. And I think that positions us well for Singapore's future as a biomedical hub.
Singapore is really where it all comes together. We have a strong ecosystem with good connections across all the different players that can have startups succeed in bringing good healthcare solutions to the rest of the world.
We see great science here, and what makes Singapore more unique is its global nature and also the trust in the quality and integrity of its science. It's an emerging ecosystem, yes, but it's one with great potential to accelerate innovation.
Ultimately, we know the fight against cancer is global, and taking the best technology we can develop to the world is really our mission.
As Singapore continues to lead the charge in healthcare innovation, the question is not if, but when these technologies will reshape the future of global healthcare.